Cotard's delusion, also known as walking corpse syndrome or Cotard syndrome, is a rare mental disorder in which the affected person holds the delusional belief that they are dead, do not exist, are putrefying, or have lost their blood or internal organs. Statistical analysis of a 100-patient cohort indicated that denial of self-existence is present in 45% of the cases of Cotard syndrome. The other 55% of the patients presented with delusions of immortality. In 1880, the neurologist Jules Cotard described the condition as the delirium of negation, a psychiatric syndrome of varied severity. A mild case is characterized by despair and self-loathing, while a severe case is characterized by intense delusions of negation and chronic psychiatric depression. In this context, delusion of negation refers to a delusion in which one imagines that the world has ceased to exist, that nothing is real. It is also synonymous with nihilistic delusion. The case of Mademoiselle X describes a woman who denied the existence of parts of her body and of her need to eat. She said that she was condemned to eternal damnation and therefore could not die a natural death. In the course of suffering the delirium of negation, Mademoiselle X died of starvation. If we look further into the symptoms of the syndrome, we again find that delusions of negation are the central symptom in Cotard syndrome. The patient usually denies their own existence, the existence of a certain body part, or the existence of a portion of their body. Cotard syndrome exists in three stages. First, the germination stage. Symptoms of psychotic depression and of hypochondria appear. Second, the blooming stage. Full development of the syndrome and delusions of negation. And third, the chronic stage. Continued severe delusions along with chronic psychiatric depression. Cotard syndrome withdraws the afflicted person from other people due to the neglect of their personal hygiene and physical health. Delusions of negation of self prevent the patient from making sense of external reality, which then produces a distorted view of the external world. Such delusions of negation are usually found in schizophrenia. Although a diagnosis of Cotard syndrome does not require the patients having had hallucinations, the strong delusions of negation are comparable to those found in schizophrenic patients. Neurologically, Cotard's delusion, or the negation of self, is thought to be related to Capgras delusion, the belief that people have been replaced by imposters. Each type of delusion is thought to result from neural misfirings in the fusiform face area of the brain, which recognizes faces, and the amygdala, which associate emotions to recognized faces. The neural disconnection creates in the patient a sense that the face they are observing is not the face of the person to whom it belongs. Therefore, that face lacks the familiarity normally associated with it. This results in derealization or a disconnection from the environment. If the observed face is that of a person known to the patient, they experience that face as the face of an imposter, in the case of Capgras delusion. If the patient sees their own face, they might perceive no association between the face and their own sense of self, which results in the patient believing that they do not exist, in the case of Cotard delusion. Cotard syndrome is usually encountered in people afflicted with psychosis, as in schizophrenia. It is also found in clinical depression, derealization, brain tumors, and migraine headaches. The medical literature indicate that the occurrence of Cotard's delusion is associated with lesions in the parietal lobe. As such, the Cotard's delusion patient presents a greater incidence of brain atrophy, especially of the median frontal lobe. Atrophy describes a loss of neurons and the connections between them. Atrophy can be generalized, which means that all of the brain has shrunk, or it can be focal, affecting only a limited area of the brain, and resulting in a decrease of the functions of that area of the brain controls. Looking at pharmacological treatments, antidepressants, antipsychotics, and mood stabilizers have all been found to be successful in treating the syndrome. Electroconvulsive therapy, also known as electroshock therapy, has been noted as an effective alternative. And that about wraps up this brief introduction. I hope you got something out of this video, and thanks for watching.